We here at Simple Lines Anatomy hate the plantar fascia. We loathe the plantar fascia. Always walking around. Oh, I support the arch of the foot. Good for you. I support my family. Well, I mean, not financially or emotionally, but I'm around at times. So we must teach the plantar fascia a lesson. We must show it who's in charge. And the best way to do that is with pain. And the best way to do that is with inflammation. Inflammation or itis causes quite a bit of pain to the plantar fascia. If we can get the plantar fascia itis, oh yes, that's quite a bit of pain for the plantar fascia. To create inflammation, we can use radiation, infection, but we don't have access to any of that, and it's probably for the best. I wouldn't trust my coworker Clark with a ballpoint pen for the most part. But one other thing that works quite well to cause inflammation in the plantar fascia is strain. Strain on the tissues. And to create strain in any soft tissue, but especially the plantar fascia, we need to separate the tissue, take its attachment points, and drive them far apart from one another. This causes stretch, then strain, and maybe even tearing of fibers. Perfect. But we can't do this just once. We have to find a way to put it there and hold it there. And we've found a way that we can get the body to hold the plantar fascia in this strained position indefinitely. To start, put the body above the plantar fascia into a general flexion. In a general flexion, the weight of the body is driven forward, and the center of gravity along with it. This puts the weight, which should instead be on the ankle and calcaneus, to the arch. When the arch is loaded, it starts to collapse, starts to drive the plantar fascia apart, separating those tissues gradually, slowly, painfully. But there's more. There's more if you really want to inflict some pain. Specifically, if you create lumbar flexion. This drives the pelvis posterior, a posterior pelvic tilt. That tilt locks the hips, changes the way they move, ultimately driving them inward as they step, as they move, and even just as they stand. This then pushes the tibia laterally. When the tibia goes lateral like this, the weight of the body pressing down from the femur loads the arch to the inside of the foot, and this starts to separate the plantar fascia as the arch fully collapses. If you can hold these positions in the body, you can punish the plantar fascia for as long as you want. But do not let your work be undone. Avoid anyone who can retrain the body, anyone who can mobilize the soft tissues and joints. They will reverse your work. These people are betrayers. Hashtag plantar fasciitis.